everyone, my name is Grace. I'm an English language teacher and one of the teachers here at SGR Focus Training. In this video, we will discuss the OET Speaking subtests, overview, format, and structure. The test is delivered individually and will last for around 20 minutes. The test requires you to role-play 2 different medical situations with an interlocutor. The materials used in this test are specific to your profession. You will play the part of a doctor if you're a doctor, a nurse if you're a nurse, so on and so forth. Your interlocutor will play the part of your patient, the patient's carer, or the patient's family. It could be the husband or the wife, the adult son or daughter, or perhaps the parent of a young child. The interlocutor will never play the part of a child and will always be an adult. The test is split into 3 parts. You have pre-test introduction for part 1, followed by role-play 1, and then the last part is your role-play 2. In each speaking test, your identity and profession are checked by the interlocutor, and there is a short warm-up conversation about your professional background. The warm-up questions will be asked by the interlocutor, and this will revolve around your professional background. Some of the common questions are: what kind of work do you do? What do you like about your work? Or perhaps describe a typical day at work. Remember that these questions are not assessed. The test is designed to make you feel comfortable in the test environment and be familiar with the voice of your interlocutor. After the warm-up question, role-play 1 will begin. You will be handed a role-play card and will begin 3 minutes. You will be given 3 minutes to prepare. You are allowed to write notes, underline, or encircle keywords. Your role-play card will include information about the setting. This means where is the conversation happening. In this instance, it's in a children's hospital. The middle part of your role-play card will provide information about your patient. In this instance, we have the age of the patient, the condition, which is asthma, and sometimes the emotion of the person that you are speaking to. Because we are speaking to the parent, you will see that the parent is anxious and agitated. At the bottom of your role-play card will be a list of tasks. Now, the test is related to real-life situations, which means that you are expected to demonstrate a range of communication skills that you normally do in your everyday work as a medical professional. Some of these communication skills could be how to elicit information or ask questions. A lot of the role-play cards will ask you to do explanations. And if your patient is a little bit worried or concerned, they might ask you to demonstrate reassurances. And typically at the end of the role play, you might have to give recommendations or provide advice. Sometimes these recommendations and advices are not welcomed by your patient. Hence, one of the other skills that you need to demonstrate is the skill of persuasion and encouragement. After the warm-up question is finished, the 3 minutes of preparation, you will then begin the role play itself. The role play will last for around 5 minutes. This part is assessed and it will be audio recorded. Remember that you are allowed to look at your role play card anytime during the actual role play. After role play 1, Roleplay 2 will begin. Again, you will be given a roleplay card with 3 minutes to prepare. Once the preparation time is up, you will be asked to start roleplay 2. Again, this part is assessed and audio recorded for 5 minutes. Your 2 role plays will be assessed based on 2 sets of speaking criteria. The first set is the linguistic criteria. Under the linguistic criteria, you have intelligibility, fluency, appropriateness of language, resources of grammar and expression. In here, the assessors would look at the impact of your pronunciation, intonation, accent, smoothness and speed of your speech, the choice of language, vocabulary and tone, as well as the general level of grammar accuracy. In this criteria, you will be given a maximum of 6 points. In order to score a passing grade B, you will need at least 5 points out of the 6 points within the linguistic criteria. Your set 2 is your clinical communication criteria. In this set, you will be assessed based on relationship building, understanding patient's perspective, providing structure, information gathering, and information giving. What's being tested in here is how well you open the conversation. Did you demonstrate empathy and respect? Did you listen and incorporated your patient's perspective into the conversation? How well you organize the information that you are giving, and also the way that you ask, and also the way that you answer questions from your patient. In this set, you will be given a maximum of 3 points per criterion. In order to get a grade B, you will need at least 2 points out of the 3 points in the clinical communication area. Now, the criteria for the speaking subtests will be discussed with you in more detail